So Gauteng is in its third wave now. We all should be keeping our guard up. Meanwhile, the country's official death toll has tipped over the 55,000 mark, although the Medical Research Council believes the real figure could actually be 3 times higher. Let's get some details on the road ahead for Gauteng and the Free State that are now officially in a third wave, and of course for the country as a whole because infections are up. I'm joined by Dr. Harry Moultrie, Senior Medical Epidemiologist at the National Institute for Communicable Diseases. Good evening, Doctor. So just how bad is it for Gauteng at the moment?
Good evening, Sally. Good evening to your viewers. Gauteng is seeing a very sudden increase in cases, an increase in the percentage testing positive, early signs of increases in admissions. In terms of whether we define it being a third wave or not, I think what's more important is that we have to respond now. Clearly cases are increasing, transmissions increasing, and individuals need to respond, as well as the health system to make sure that our healthcare system is prepared. If we look at the last sort of most recent day's stats, the 7-day moving average in Gauteng has doubled in a little over a week. And so this growth rate really is concerning, and we do need to respond.
I know that deaths have also ticked up in Gauteng, but what about hospitalizations? Is there a lag there? Is that probably going to come in the next few weeks?
The big increase will come through probably in the next week or 10 days, and we'll see it in the data. There's a bit of a lag, but we're already beginning to hear and see some signs in specific facilities of increases in admissions.
Can we trace a line directly back to what we did over Easter, do you think?
I think there's certainly an indication in the data that Easter created a perturbation, the transmission or increased transmission, and that has taken some time to build up some steam and is now coming through the system. Certainly when I look at all the trend graphs, there does seem to be a clear inflection point shortly after Easter.
You say we need to respond now. In fact, the whole country needs to be on high alert because infections are on the rise, whether we call it the third wave or not. What do we do? Because there are certain people who will continue to wear their masks, who've continued to be fairly careful, but a lot of people who don't, who are just letting things slide a little bit. How do we galvanize all of us to get back on board this COVID train?
It is difficult. It has been a tough year, and COVID fatigue is real, and people do struggle with it. I think what's important to remember, though, at this particular juncture, that delaying or slowing the third wave can really save lives. We are starting the national vaccine rollout program on Monday, when the most vulnerable people over the age of 60 will start being able to access vaccines. Up to this point, it's only really been healthcare workers. And so if we can delay this surge, this resurgence, by even 2 or 3 months, it will give a chance for a fairly high proportion of most at risk to get vaccinated and to be safe and protected. So in order to do that, we have to really take quite seriously the social distancing guidelines, particularly around indoor confined spaces, large gatherings, and increasing contact rates. It's time for us to perhaps take a winter breather, to reflect inwards and spend less of our time networking with other people, reducing our contacts.
Do you think we need to have certain restrictions in place? There's lots of talk of, well, we need to go to level 3 of restrictions now. We need to have perhaps curfews. And as you say, those gatherings need to be shut down quite quickly. What's your feeling?
It's a difficult one. The discussions are certainly ongoing, I'm sure, within the National Department of Health and other structures around the potential implementation of additional restrictions. I do think that some of the restrictions around the less damaging restrictions, which are less damaging for the economy of the country, we should really be considering doing that. So that's really restricting large gatherings again. Nighttime curfews, but perhaps quite late to allow the restaurant sector to continue safely. And perhaps reducing some of the unnecessary sort of gatherings and activities that happen.
Would you say that workplaces need to be considering going back to hybrid working models, thinning out the amount of people that actually set foot into the office where they can?
I would, yes, if at all possible, I would absolutely recommend it, particularly in workforces where you might have large numbers of elderly people or people who live at home with their grandparents. Certainly workforces where possible, working from home if you can do it and you can still be productive. I would advise people to do it, absolutely.
What is your feeling on schools? We know that 10 schools in Gauteng have already cancelled their sporting events. Do you think that schools should immediately go back into a rotation platoon system, or bearing in mind that children are not as adversely affected, we shouldn't do that?
My personal view is that schools should remain open for educational and learning purposes. I think some of the ancillary activities, afternoon sports, extramural activities, a lot of those assemblies, school assemblies, some of those things can be curtailed. But certainly my view is that schools should remain open. Children have borne an incredible brunt as a result of COVID-19 last year, and I really don't think we can afford to continue disrupting education any longer. That's a personal view. It might not be the view, to be clear, of
Sure.
my organisation.
Sure, but you are an epidemiologist and you have a level of expertise, and it's a very interesting viewpoint. I want to ask you about the vaccination program. If we look at the registrations, we've seen sort of over 900,000 healthcare workers registering so far for a vaccination. We know that hopefully by the end of the weekend, 500,000 of them will have received it through Sisonke. The rest will then go into the 1B phase, which is the second part of the health worker vaccinations. If we look at those who are 60 plus, and the focus will move to them from Monday, some 1.1 million have registered so far, and there are over 5 million eligible people in that category. So the registration is still quite low for that 60 plus category. Do you think that it's going to naturally tick up as people see their peers getting inoculated, though?
I'm not sure that the slow registration is as much a function of hesitancy as it might be a function of access to the internet systems, the ability to log on and to make an appointment. I do think that perhaps we will find that in the initial weeks of the opening up of the vaccine program, there'll be considerable pressure. That will wane over time, but I certainly think that the vaccination program does need to allow for people to register on site in person without having to do it through the electronic platform. I think that might pose an obstacle to people in terms of their registration.
All right, thank you so much for your time this evening. That was Dr. Harry Moultrie, Senior Medical Epidemiologist with the National Institute for Communicable Diseases.